Testing for COVID-19 remains the critical factor in gaining a better picture of the reality in our state. Health experts warn the number of reported cases is a fraction of the actual number. AZPM's Jake Steinberg reports.
It started with a dry cough.
When I thought I was getting sick, the COVID thing was, all I knew about it then was that it was happening in China.
That was 2 weeks ago, before the president declared a national emergency.
We will overcome the threat of the virus.
And the country began to shut down. Harper is a 31-year-old network engineer who describes himself as an introvert.
But no, and that was actually what was awakening to how serious this could possibly become is I don't have a lot of contact. I don't shake people's hands. I already wash my hands 40 times a day.
He decided to self-quarantine just to be safe. Last week, he heard Banner Medical Center in Tucson was opening a drive-through testing center. After waiting in line for over an hour, he was told he wouldn't be able to get a test and was sent home. The same thing happened when he went back the next day, after his symptoms got even worse.
You hear shortness of breath. What I think to myself is the feeling you'd feel when you had just finished running really hard, and you can still, catch up to it kind of thing, but it's a strange feeling where it's your lungs can fully expand and yet it's not helping.
Despite his symptoms, Harper still hasn't been tested for COVID-19. That's because there are so few testing kits available. Only the most vulnerable members of the community can be tested. According to criteria set by the Centers for Disease Control, first priority are hospitalized patients and healthcare workers with symptoms. Then it's older adults and people with underlying health conditions. Young people are not a priority, but according to Casey Ernst, an epidemiologist at the University of Arizona, they're the ones spreading the virus. She compares the situation to an iceberg.
The number of reported cases that we see are what's sticking out of the water, right? And underneath are all of the asymptomatic cases, the people who are mild, who haven't gone to the doctor, the people who have gone to the doctor but can't get testing for whatever reason.
She says low rates of testing means it's hard to know how many cases are really out there. But it could be as many as 10 cases for every one reported.
So this iceberg, as it gets bigger and bigger, a larger portion of that iceberg is going to be sticking out of the water. And it's growing at an accelerating rate as well.
She says we're still early in the outbreak in Arizona, but if our trends follow other states, cases could explode this coming week. So the best measures are still for everyone to act like they're carrying the virus. Stay home, keep your distance from others, and wash your hands.